is a kind of true ligament. And this one is zygomatic cutaneous ligament. It's also the true ligament. It derives from the bone, go up all the layer to the skin. And this one, we have superior temporal septum and inferior temporal septum. It derives from the temporal thickening. And also we have this one, orbicularis retaining ligament, which is the true ligament also. And here we have masseteric ligament. It is the false ligament because it's come from the soft tissue or the fascia of the masseter muscle go up to the skin. And with the time, as I told you, we have the sacking of the skin because we lost the bone, we lost the deep fat, and the superficial fat becomes smaller and move downward. And you can see that you have the protrusion in like under the eye, you have the eye bag, and also you have the malar mouth and the protrusion of the fat above the nasolabial fold.
So in this way, I think for your for Dr. Rassapoom technique, he can blend up in case of the eye bag, which is not the big one. Of course, the big one somehow is still difficult to blend. But for the smaller eye bag, this way, I think it can be treated nicely. Okay, Dr. Rassapoom, please.
Can you see my slide?
Yes.
Yes.
Okay, thank you. I'm sorry for the connection. Yeah. Okay, then. Okay, so when you're gonna treat the second floor, I mean that you're gonna treat the orbit and also the orbicularis retaining ligament with the softer filler. You create a structure around the orbit from the lateral to the medial, but do not inject or do not put the tip of the needle above the orbicularis retaining ligament or the orbit. Otherwise, you're gonna create the eye bag, the more eye bag. So you must be careful about this one, and as told you, you have to feel where the tip is to make sure that you are in the right place. You're gonna inject with the a bunch of micro liquid around the orbit to create the structure around the orbit, so increase the tightening of the orbicularis retaining ligament.
For eye bags, the involvement of the appearance of this is from skin and ocular muscles that have laxities because of the aging, and also the combination of the skin and the fatty tissue that support the eyelids, so-called like SMAS, and the protrusions of the infraorbital fat pad. So mainly you have to divide it to problems that if the patient has true herniation of infraorbital fat pad, you recommend to go for the surgeries. But if the patient has maybe just mild herniation combination with the weakness of the orbital eyelids, so we recommend to go for like some supportive treatment, maybe fillers, maybe the minimally invasive for lasers and energy-based device, like I discuss in this talk. First, before you decide which to treat, this classification is quite good to classify the severities of the lower eyelid defect. So my case could be like volume deficiencies. I would like to combine with the thinning of the skin as well, that have the appearance of both of the volume loss and also laxities of the lower eyelid that create the skin sagging.
So for my topic is about the non-surgical eye bag removal by blind cannula RF. It's internal RF. It's not only for the external RF. So this is my profile and my disclosure. So actually, because I'm the last one, so like I'm gonna talk about the wrap up of this section too. So when we see the celebrity, they all have the same things that make them always look a bit tired. What do you think about this picture? They all the same have the lower eyelid protrusion or eye bags. So this is the one character that can make you look a bit tired all the time. And when we talk about this thing, I just introduce you about the periorbital aging, what we're gonna have when we age. The first, we have thinning of skin adjacent to the eyes. We have sagging of skin due to increased laxity and collagen loss. And also the weakening of the muscle and tissue structure supporting the eyelid.
And the third pile of the first four or the foundation is psychomedical cutaneous ligament and the anterior part of the midface. And then go to the second step or the second floor of the treatment, which inject with the filler around the orbit to create a structure around the orbit and also tighten the orbicularis retaining ligament with a softer filler. That's it in my lecture.
Thank you very much. Dr. Marisa, please.
Thank you.